So good morning. I'm here and I'm Sue Rosenhain. I'm from the Inner East Primary Care Partnership and I'm having a cuppa with Sara Hanna from Headspace Hawthorn this morning. So good morning, Sara.
Good morning.
And as we meet, I'm on the unceded lands of the Wurundjeri Woiwurrung peoples and I pay my respects to their elders past, present and emerging. So before we get going, have you got a beverage to sustain you through our chat?
I was going to say, I actually feel like a really bad guest because I finished my cuppa before we've got started. So
oh well, you've had a couple with in a way, and I've got the last of my cup of tea too. So tell us a bit about yourself, Sara, and the role and Headspace generally.
So my name is Sara. I use she, her pronouns, and I live and work on Wurundjeri land. So my role is community engagement worker at Headspace Hawthorn. So I've been at Headspace for 3 years now. I was previously in a project support role. But for those who aren't aware, Headspace is the National Youth Mental Health Foundation, and we provide mental health support to young people aged 12 to 25 and their family and friends. So Headspace has a range of digital services like eHeadspace, the Work and Study program, but there are over 135 Headspace centres across Australia, and no two Headspace centres are the same. So they each offer unique services to the needs of the local community. So yeah, at our centre we provide a range of services for young people and families, and also deliver mental health education and awareness in communities, which is a part of my role as a community engagement worker. So some of the key areas of my role include health promotion, youth participation, community awareness and stakeholder engagement.
So a lot of what you find in your role will inform the design and structure of what Headspace Hawthorn provides.
Yeah,
so they're all responsive to local communities. So obviously yours is a critical role to provide that intel.
Yes,
generally, yeah.
So I guess it's important that we're regularly doing needs analysis and making sure that we're across what young people are needing in terms of their mental health in the local community, and that usually informs our community engagement and awareness plan and the activities that we'll do throughout the year for young people.
Yeah, good. So what does your average week look like?
Yeah, it's quite interesting because my role is really broad and varied. So I guess every week looks a little bit different. It's quite a combination of tasks, I would say. So things like designing and delivering presentations and workshops, running information sessions, partnership meetings, network meetings, creating promotional material for events and activities that we're running, planning and delivering groups, facilitating YAG meetings.
So tell me YAG?
Sorry, YAG, Youth Advisory Group.
Yep.
Yeah, and things like running stalls, attending community events, just responding to emails and inquiries. Another component is creating content and posting on our social media. So few different things.
Yeah. What's going on? Yeah.
Yeah, never a boring day in my role.
That's good. So what interests you or engages you about the work?
That's a
How long have you been there, did you say already? How long?
3 years.
3 years, yeah.
Yeah, that's a good question. A lot of things really interest me with this work because I care a lot about mental health, and I really enjoy working with young people, which summarizes my role. Really. One thing that really interests me about my role is working with our youth advisory group quite closely and being able to give them opportunities to get involved in their community and make a difference to youth mental health services. So I enjoy being able to be a part of, I guess, helping them to work on projects that are of interest to them, that they're passionate about, and seeing them, I guess, flourish in the role and the activities that they get involved in is something that, brings me a lot of enjoyment in the role. I also really love working collaboratively with partners on projects and events. I think it's a great way to not only learn from other people, but combine resources and skills to do bigger and better things in the community. So yeah, I've been lucky to work with quite a few different partners in the local community in the time that I've been here, but also grateful to have such a big team around me that I can learn from, with different backgrounds and expertise and knowledge. So my immediate team at Headspace Hawthorn, but also working quite closely with community engagement workers across the country. I'm also a part of the health promotion team at Access Health and Community, which is our lead agency. So there's just, a lot of different opportunities to connect with people who are doing similar and different roles from me and learn from them and grow as an individual and as a team. So
yeah, there's so much variety and so many connections. Must be fascinating to hear what's similar across the country and what are the different experiences.
Yeah, it is really interesting because I guess essentially a lot of us are doing the same role, but how that looks is really different depending on the region and the community that you're working in. But I think it's really great to be able to chat to people about how they do things and see if it's something that I could try in our community and how that could look. So yeah, it's really great in that regard.
Yeah. So, and that's sort of how we met, wasn't it, around a local project and thinking about working together on work about the impact of climate change and the mental health on young people. And obviously it's been a big year and big couple of years. So in the context of climate change and mental health on young people, but also in the time of COVID, that is when we started having our conversations. So really big issues for all of us to be dealing with and thinking about and understanding our place in relation to what happens next, but perhaps with some particular impacts for young people. So what are some of the things that you've noticed perhaps in the last 18 months, 2 years, in comparison with perhaps that first year, 18 months in the role?
Yeah, I think one thing that's been really interesting with COVID is just how different everyone's experience has been. Like, I don't think any one or two people would have had a similar time with lockdown, depending on, I guess, some individual circumstances. So I think what's been really interesting is, we can identify some challenges that young people may have faced, but for other people that may have been a positive thing for them with COVID. Like, some things that come to mind is just the isolation. Like, some young people may have really struggled with not being able to connect with people physically because that's what we have always known, whereas for other young people, not having to go to school each day and not having to socialize all the time might have caused less anxiety and stress for people. So I think, just highlighting that everyone's experience has been really different, and what may have been a big challenge for some may have actually been a relief in a way for some others. I think as well, highlighting that, some young people may have had exacerbated mental health difficulties with the pandemic, but again, for other people, that may have taken away some stress and worries from their life. I think one positive thing has been that this is a time where we can all, I guess, reflect on what helped us cope in a really challenging time, in the sense that, like, over the last 18 months, there's just been constant changes and having to adapt and I guess change the way that we're doing things in line with restrictions. So I think now a positive thing that we can all do is look back on the last 18 months and find out what has worked for us in terms of taking care of ourselves, and what are some new things that we've done that we can take into the future that may help and support our day-to-day lives.
And I guess that's on a individual level, but also when we think about it on a service level as well, you know.
Yeah,
so not just
sure.
try and reboot to how it was, but what's helped some of our clients and community, so that we can continue with perhaps some hybrid models and can expand our opportunities for engagement. So it's given us a fast forward into some new ways of doing things in some ways.
Yeah, I think that's absolutely been a positive of the pandemic. Like, I know before COVID, all of our appointments were face-to-face, whereas now we're able to offer a combination of face-to-face, video, and phone. So for some young people, a positive of the lockdown may have been that it was easier for them to access support by having a telehealth or phone appointment. Like, previously you would have had to make time in your day to come to an appointment. So, you know, if you're working full time, for example, there may be a high demand for an after hours appointment, whereas if you can fit that into your lunch break, then that's probably a really good thing for some people. So I think, just being able to offer different ways that meet everybody's needs is a positive from the pandemic. And, you know, even just in the in lockdown, we ran a few parent carer webinars, which I think have been great for parents and probably a lot more accessible for some of them, being able to join from home, whereas sometimes having to commute to things is, you know, just
too much to put in the day.
So I think there's definitely,
or leave young people, you know, when they're concerned about that.
Potentially find someone to be at home with the kids so that they can go to things like this in the communities. So I think it's great that we can, like, not leave all those things behind and carry some of them forward to make services accessible and inclusive for everyone.
And obviously these are, you know, I talked about a couple of the big things. Any other things that people are talking about that isn't about COVID and climate change and what else is in the mix of conversations with the ag and others?
Well, I guess it's a tricky one, I think, because COVID has in a way really been front and center for a lot of people over the last 18 months. So I think it's about, you know, what are some other things that we do want to talk about and address now that we're moving out of this? Because I think, unfortunately, you know, maybe some things have not had as much attention as maybe they were before this time, because, you know, a pandemic is a really big thing. So I think now that we're starting to live in this new normal life, hopefully it can make way for some other kind of conversations.
Which is kind of a lead into the next thing I'm interested to hear about, is the things you think we need to keep an eye on as we emerge from lockdown and the acute phase of COVID and the pandemic.
I think the first thing that comes to mind for me, there has been a lot of excitement for a lot of people. Like, a lot of people have been looking forward to this moment where lockdown ends, restrictions have eased, borders are opening so that they can, reconnect with loved ones and travel and start doing those normal life things again. But for some people, re-entering the world and the new normal that we find ourselves in could be anxiety provoking. So I think the biggest thing is just that we are really kind and respectful to ourselves and others, just because we're not all going to have a smooth transition after this, and for some people the effects of lockdown and the isolation that we've had might take some time to adjust back to this new normal. So I think we just need to be really mindful of that, and keep in mind that everyone's on a different journey with this.
Yeah. Nice message. Let's be kind.
I guess, even the first one thing that comes to mind for me as an example, particularly, is socializing. Like if you think of young people that maybe were starting year 7 when this all started, they'll be going into year 9 this year and have probably spent very little time with their peers in person. So really it might feel like they're starting fresh in year 7 in a way, because they haven't had as many face-to-face opportunities to connect with people and build friendships and peer relationships and everything. So I think things like that could really take some time.
Want to keep an eye on it all.
Yeah, to adjust to.
And to make a long-term difference to some of the challenges and experiences that you see young people face, not necessarily challenging, but just experiences, what changes do you think we need to make in society? What would you like to see being done differently?
That is such a good question. And to be honest, the first thing that came to mind just now, as you said that, was I would love to know what young people would say to this question. So I think essentially that's my answer. I think one of the kind of key things we try to do in health promotion is working with communities, not for them. So I think, similar with young people, nothing for them without them. So I think we're definitely seeing that a lot more in the opportunities that are available for people to have a say. But I think, young people absolutely need to be front and centre for the things that are affecting them, and can be, involved in decision-making processes, and all those important things. I guess, essentially they are the experts in their own lives. So I think we need to be, I know that happens, but I think it's kind of crucial as we move into the future and see some kind of key challenges that are unique to young people, that they are front and centre in the things that we do for them.
Yeah, which is part of our conversations, isn't it, with the YAG about the climate change, and what emerged from that was, again, continuing with your theme and experience from earlier, that it's not all the same for everyone. The things that were different and what different members of that group want to see happen, it's not just one thing, and that people have different capacities and interest in how they might want to contribute to making a difference or engage with the issue or their peers, or what they want to see other people doing, and
for sure
what would be valuable going forward.
As well, making sure that as much as we can, giving a voice to different groups of young people as well, and making sure that we're hearing different voices in these discussions as well, because like you said just now, everybody has different interests and experiences, barriers, protective factors in their lives. So making sure we're getting the full picture as much as we can and hearing a range of different voices to shape what we do in this space.
Which I can't help then think back to, or brings to mind, the Inner East Primary Care Partnership social inclusion framework. One of the elements of social inclusion, of course, being having a voice, and the dimensions of that being that everyone has the resources, opportunities and capabilities they need to have a voice. So we need to be mindful of what is it that we can create that people do have those resources, opportunities and capabilities, and in everyone, but in this context, young people, in order to have that voice and contribute. So it's about providing platforms and opportunities, but it's also about resources and capabilities.
Absolutely. Yeah.
So thanks for demonstrating the framework in action.
You're very welcome.
So was there anything else that you wanted to say that you might like to say? So this is largely a couple with our e-bulletin for Inner East Primary Care Partners and other organisations, but
well, I guess if
anything else that's important we should know.
If anyone's still listening, thank you for getting to this point in the coffee with. I think, just in terms of working with partners, I like to think I'm quite an open book and, welcome any partners to get in touch with me and have conversations about what we could potentially do for young people in the local community. So just get in touch if you want to connect and chat and see what we can do together.
And I can only reiterate that because of our experience of working together with the climate change and young people.
Oh, thanks,
so,
Sue.
it's been great to meet you through that. Initially, and certainly good conversations, and nice to have,
continue them into the future.
All right,
thanks,
thank you so much for your time, and really appreciate. It's always good to have a chat.
It is.
And I always learn more about your work and headspace, and
thank you.
Exciting and important things and contribution that you make.
We'll chat soon.
Yeah, we will. Thanks.
Thanks.
Bye.